ask you a little bit about employment and the workforce here, specifically the private workforce and the governmental public workforce. For all employees, I look at all employees as having three legs to a stool in terms of what they get. One is wages, one is benefits, and one is retirement. The question that I have, it's a general question, I want to emphasize that, but I hope that you can expand on it, is generally speaking, today, do you think the private workforce and the public workforce are on a level playing field? Do you think that they're getting about the same thing?
Well, the nature of their jobs are different, and this is always a difficult comparison in a lot of different ways. State employees tend to have more security, perhaps, than people in private sector, but people in private sector frequently have more kind of an upside potential of catching the gold ring and getting involved in a business that works very well. So I think it's really hard to make comparisons, but there have been groups that have attempted to do so in the salary survey that is done. And I think by and large, my review of the salary surveys that are done by objective people who are economists, I have a degree in economics, but I'm not sure I'd call myself an economist, but those people who are trained in this seem to suggest that there is a fair amount of parity in the public-private sector. And my reading of this is that public sector in our state is a little lower in the wage and hourly compensation and a little richer on the healthcare and benefit side, but that they are relatively in the ballpark. Now, there's pluses or minuses. I'm sure that one could argue on both sides of this equation on certain percentages. But let me anticipate another question. We have some work to do to reduce the taxpayers' costs associated with public employment. And I think that is a legitimate goal for us for this reason. We have had a very significant inflation rate associated with some of these expenses. And given our circumstances, we have got to attack that inflation rate associated with both public employees and beneficiaries of some healthcare services. So I am very intent on trying to reduce the cost to the taxpayers of healthcare benefits associated with folks that the state's now paying for. And I have a plan that I believe we can succeed in doing that. And it is based several principles, one of which I saw in action at Salmon Creek at Legacy about 2 hours ago, which is embracing lean management systems to bring efficiencies to the operation of our healthcare system, which is going on at Legacy, which went on at Virginia Mason Hospital, which can drive significant reductions in costs. Number two, I want to embrace preventative healthcare systems that can get people to start dealing with health rather than just sickness, so we can really have a healthcare system instead of a sick care system. And we have some progress on that, but we got to have a lot more progress. Third, we've got to engage our state employees and Medicaid beneficiaries in being more participatory in their own health. And that means giving them incentives to embrace some of these fairly modest things that can help us reduce healthcare expenses by living a healthier lifestyle. And people that have done this have saved very significant sums. King County has done this in conjunction with their employees, and they've saved $61 million in the last 2 years. Last, we need to embrace payment reform so that we are paying for value rather than volume. Right now we pay for fee-for-service medicine, and we're paying for volume rather than value. And we need to find and insist upon systems that are based on accountable care organizations. So if we do those things, I think we can reduce the cost to the taxpayer of the compensation package for our state employees and have healthier state employees.
Are you aware of the statistics between the number of private employees that have pensions versus the number of governmental employees that have pensions?
Sure, there are differences.
Do you know what those differences are?
They're significant.
What is that? Does that signal or say anything to you in terms of what we are giving public employees versus what private employees are able to give their employees? Does that say anything to you?
Yeah, it says that there are differences, and it
I got that.
harkens back to what I said, the very first thing I said. I think that generally speaking, I'm giving you my impression. Generally speaking, I think some of the benefit packages for public employees are on the richer side, and this is one of the instances of that, than in the private sector. But according to the salary system, on the compensation system, on the wage side, and again, this is the salaries survey done by the experts, not me. I'm not an expert. They basically concluded on the wage side is a little lower than the private sector. So my view is we've got to find out where that combination is to make sure we are fair to the taxpayers, adequately retain qualified personnel to provide us health care and nursing care and firefighter care and everything else we need, and keep the state afloat. And I will be a governor who does all of those three things.
One more follow-up question on this area. Here's a suggestion. Put every public employee on a 401k, like most private employees are on, and then have public employees bargain for higher wages if they can support the idea that that's inequitable. What do you think of that idea?
I'm sorry, bargain?
We know that public employees bargain.
Mm-hmm.
Most all, many are supported and represented by unions. Put every public employee on a 401k system, and if in fact that the wages are not equitable, as these studies that you see suggest, have them bargain for higher wages, but get them off of pension plans, so that so that the private sector is on an equal footing with the public sector.
All things need to be bargained in these transactions. The point I would make is you need to look at these as a package, and that's one way you're suggesting, I suppose, to look at a package.
Right.
Now, the other way to say have a packed compensation system and then bargain the pension. You could flip it around. I see what you're suggesting. I think the ultimate goal is to get a fair package.
Right, exactly. So that's a possibility, at least.
I haven't thought through the ramifications on that. I have to think about the ramifications of that.
You'll get back to me?
Sure, I'll be back.
All right.
Come back lots.
Thank you.